This is the showdown Baki fans around the world have been waiting for. Baki Hanma versus his father Yujiro Hanma is a fight that will determine who is the strongest creature on Earth. The incredible power and durability of these two fighters give us many chances to deepen our understanding of human anatomy in a very dynamic lesson. Let's not waste any time. Yujiro sends Baki through the window with a blow to the midsection. I suppose Baki was tensing the muscles of his abdomen, rectus abdominis, transverse abdominis, and external oblique muscles in order to absorb the impact. Doing so creates a rigid layer of protection for the abdominal organs, mitigating some of the force. With a smile on his face, it's clear that he's looking forward to the fight.
Yep, that's me. You're probably wondering how I ended up in this situation.
A kick between the low back and side body powerful enough to send Baki flying through what appears to be a concrete wall? In any normal human, I might be concerned about various types of lumbar vertebrae fractures, damage to intervertebral discs, or even to the spinal cord itself. Solid organs are especially susceptible to compressive forces, and those near the point of impact, right kidney, liver, could lacerate or contuse. It is conceivable that if Baki drew his shoulders into flexion, folding his forearms back over his head, his elbows would have connected with the concrete wall, preferable to the top of his head. Just don't expect your olecranon to break a fall like Baki's. But of course, we're just getting started, yo. With Yujiro's enormous hand clamped around his face, I can't imagine Baki is able to breathe. When you think about it, you really only need to plug a couple of holes and, well, goodbye oxygen, goodbye vitals. But when you're plummeting 40 stories, head first towards the ground, suffocation is like the least of your worries. By holding Baki's face below him in the air, Yujiro forces his son's cervical and thoracic spine into extension. It's almost like he's doing a bridge or up dog in the air. Needless to say, if you're gonna fall from a height, you wouldn't want to land face first while the neck is extended above it. You can imagine the head stopping against the ground while the rest of the body continues to fall downward, and the cervical spine snaps further into extension to accommodate gravity. Here, Baki's position has changed, and his neck now curls slightly forward into flexion, and he protects the top of his head from impact with his arms. No amount of superhuman arm and shoulder strength would be sufficient to prevent a catastrophic head and neck injury here. The force of the landing would be translated through the fingers and forearms into the skull and brain. Were a human to connect with the ground in this manner, I would expect an aggressive splatter with a lifeless body collapsing over top. If, alternatively, they landed on a car, the bent metal roof would bend and mitigate the power of the impact to some degree. But even if the skull doesn't shatter, the body would still bend forcefully over a flexed neck, and all manner of cervical fractures such as compression fractures, cervical burst fractures, and cervical flexion teardrops could result. But hey, maybe Yujiro feels bad for being so heavy-handed. Then again, I'm sure he won't take this lightly. So the facial skeleton consists of 14 bones, 6 pairs and 2 unpaired bones. I have a feeling we'll get to know many of them over the course of this video. Both Baki and his father's slap connect with the zygomatic bone, which forms the prominence of the cheek, and thus is also known as the cheekbone. When this region is fractured, a patient can look forward to surgical plates and screws in their face. Generally, the even distribution of the force of the slap over a greater surface area than say a punch would usually reduce the likelihood of a fracture. But a slap with enough force to send Baki flying through another window? Maybe not. Not to mention the horizontal or rotational force that would be applied to the cervical spine. And yet, Baki seems to be fine. By his standards, I don't think the fight has even begun yet. Yujiro, still playing the role of a disciplinarian parent, administers 2 whip strikes, a technique that involves making the body as loose and fluid as possible, allowing the practitioner to use their arms like a whip, usually targeting the largest human organ, the skin, with painful slaps. Shades of Will Smith, yo. According to Baki lore, the technique is powerful enough that it can actually rend the skin off a victim's body and, as Baki demonstrated, cause enough pain that anyone hit by it will cry out in agony. Except Yujiro, of course. Go figure. So, no, a person cannot deliberately disperse pain throughout their body. Pain is a complex sensation that is typically a response to some form of injury, damage, or stress in a specific area. Specialized nerve endings called nunchucks are distributed throughout our body, and they detect and transmit signals to the brain, which interprets them as pain. Though obviously exaggerated in the classic Baki manner, there is some truth to Baki's more reserved reaction upon becoming embedded in the concrete wall. A whip or stinging slap may hurt more because they hit with focused force, which quickly activates pain nerves and involves skin with lots of sensitive nerve endings. Conversely, a blunt collision spreads the force over a larger surface area, while less sharp or direct. Here, Baki's speeding shoulder must have been met with a timely flexing of Yujiro's abdominal muscle wall, lest the organs therein be exposed to immense blunt force trauma. When the abdomen is hit hard, even without a visible cut, a myriad of injuries can occur. Contusions, commonly known as bruises, occur when blood vessels underneath the skin rupture due to blunt force. When a contusion involves deeper tissues or organs, the bleeding may not be confined to the immediate area of the bruise. Instead, blood can accumulate internally. With every impact to the midsection, contusions as well as direct damage like rips or tears to the abdominal organs, liver, spleen, intestines, and broken ribs become more likely. Looks like Baki is finally starting to get serious. Another shoulder to the abdomen for good measure, and Yujiro, with his eyes glazed over, looks to be feeling a little bit of pressure. At this point, Baki has had his back slammed against or through concrete a fair number of times. Generally, the vertebral column or spine is composed of 33 vertebrae distributed through multiple segments. And I'm convinced Yujiro is trying to fracture them all. Looks like we're still at least a few stories off the ground, and Baki landed on the square of his back with his legs in the air and nothing to brace his fall. Oh boy. Were Baki not the superhuman that he is, I would be concerned about fractures to the vertebrae in his thoracic and lumbar region, especially the vertebral arches that line the back of the body. It should be noted that although vertebrae vary in size and shape, they all follow a similar structural pattern, consisting of a body, a vertebral arch, and 7 different associated processes. A closer look at the vertebral arch and the various processes jutting out from it shows that these structures were not intended to brace even a 2-story fall. A right hook to Yujiro's mandible, or chin, followed up by a kick to perhaps the same location. The mandible is the largest and strongest bone in the human face, and the only movable bone of the skull, discounting of course the ossicles of the middle ear. Despite its size, strength, and mobility, one punch is often enough to cause a fracture. More hardware in the face. And due to the rotational force applied when struck from one side, it can cause the brain to jostle sharply against the inner walls of the skull, causing brain injury and sometimes even loss of consciousness. But I suppose Yujiro won't be outdone in the realm of facial trauma. As Baki demonstrates, the nose bleeds easily when struck because it contains delicate blood vessels close to the surface and lacks protective layers, making them more susceptible to damage. A second and third slam to the same location to drive the point home. The bridge of the nose is formed of bone nearest the skull and cartilage towards the tip, and both are relatively delicate due to their thin structure and position, extended from the profile of the face. Surely the maxilla bone, which forms the upper jaw, would also have sustained damage here. Baki is literally leaking blood from his face. And typically, when you're leaking like that, we're talking about a fracture, a more serious burst blood vessel, or something similarly not good. Or not, father and son are equally matched for a few moments until... Now, I'm not sure where Baki's attack landed, but I am incredibly impressed with Yujiro's show of hip and hamstring flexibility. Doubly so as he exhibits incredible strength while his muscles and joints extend to their limit. Not to mention the core and low back strength involved in keeping his body parallel to the ground. On the other hand, it seems like Yujiro is impressed with Baki's ability to land an effective blow, patting him on the head patronizingly. There, Junior. Baki's attempt to retaliate ends with his own shin smashing into the front of his face. The shin bone, or tibia, which plays a crucial role in supporting the body during activities like walking and running, is far more robust than bones of the face, which are generally smaller and thinner since they have no weight-bearing role. As such, a fracture to the maxilla or nasal bones becomes increasingly likely. But it seems Yujiro has already directed his attention to Baki's midsection, applying several vicious blows to the abdominal region. When you experience multiple injuries or repeated trauma to the same area over a short period of time, you can develop multiple contusions. Remember, broken, leaking blood vessels? Of course, externally, this can give the appearance of larger or more severe bruises due to the accumulation of blood from multiple sources. Internally, it's worse, as the accumulation of blood in areas where it shouldn't can put pressure on organs and impair their function, as well as increase the risk of infection if associated with lacerations or injuries to abdominal organs. If not for Pickle's intervention, Yujiro may really have put Baki on the ropes. If you guys really want it, I may react to the Baki versus Pickle fight in another video later on. Let me know down in the comments section below. And if you're enjoying this video, be sure to subscribe and let me know that as well. But for now, this is between father and son. Towards the outer portion of the eye socket, the upper portion of the zygomatic bone connects with the frontal bone. It also arches backwards, a structure referred to as the zygomatic arch, to connect with the temporal bone. You may be surprised to learn that facial and skull bones are not inherently weaker where they connect to other bones. Their connections, typically formed by sutures are designed to provide stability and protection rather than mobility. Alternatively, a lock that forces the shoulder, or glenohumeral joint, into the end range of extension takes advantage of one inherent weakness in the body. Joints are designed to allow movement and flexibility over structural strength. And although they have been reinforced with ligaments, tendons, and other tissues, they are susceptible to sprains and dislocations when subjected to excessive force. The anatomy books that I studied from just don't account for Yujiro. He's punching his free hand through the concrete ground and up and around into Baki's abdomen again. This time causing his son to urinate all over himself as he gets back on his feet. Oh my lord. The bladder is a triangle-shaped hollow organ located in the lower abdomen and held in place by ligaments that are attached to other organs and the pelvic bones. During normal function, its walls relax and expand to store urine and contract and flatten to empty urine through the urethra. When struck, it may reflexively trigger a contraction of the bladder muscle, the detrusor, to try to expel urine and reduce the pressure of the impact. The only logical follow-up? Go for the gut again, and again, and again, and again. At the very least, we know the bladder has sustained some damage. I'd wager that by now, the intestines, stomach, and liver have as well. Even without a laceration or open wound, an internal organ can be torn or even perforated. Just think of Harry Houdini. If this occurs anywhere in the intestines, for example, partially digested food in all its bacterial glory will leak into the peritoneum, the membrane that lines the abdominal cavity. From there, emergency surgery is required in order to avoid life-threatening infection and possibly even death. The bottom of the rib cage also extends into the top of the abdominal region, where any of Yujiro's blows would be forceful enough to cause a fracture. Though our rib cage is made up of 12 pairs of ribs, only the lower ribs, known as the floating ribs, do not connect directly to the sternum, or the breastbone in the front. Instead, curving downward and wrapping around to the back where they attach to the thoracic vertebrae. They both lack structural support from the sternum and a layer of protection from overlapping muscles, like their counterparts in the upper chest, leaving them susceptible to injury. A broken rib with sharp ends or fragmentation could cause further internal damage, punctures, lacerations, if the patient is, say, jostled, twisted, or turned into a pair of human nunchucks. Bro, totally possible.
In today's video, I'm going to talk about Baki logic.
The movement of a nunchuck involves rapid whipping, spinning, and even stopping motions that would virtually guarantee injuries to the tendons and ligaments throughout Baki's limbs and neck, wherever there's a major joint. Think about the elbow and knee, hinge joints designed to move in only a single plane. All Yujiro needs to do is whip Baki one way and stop him abruptly while generating force in the opposite direction in order to hyperextend the joint.
Hana, kuchi, mimi, ne. その危険度はまる。
This is getting worse and worse for the young Hanma. We've talked about the nose, but now the eyes and the ears? Yujiro then must be holding Baki by the feet, increasing centripetal force. Quickly, imagine you have a toy on a string, like a yo-yo, and you're swinging it around in a circle. The force that makes the yo-yo stay in a circle instead of flying away is called centripetal force. Now, Blood is a fluid, and fluids follow the laws of physics when subjected to forces. In this scenario, your head, being the farthest point from the pole, experiences a greater centripetal force compared to your feet. This increased centripetal force can lead to an increase in blood pressure in your head as the fluid pools in that direction. Increased blood pressure can cause blood vessels to rupture and blood to leak from various orifices, as we're seeing here. Can anyone give me an example of something that might exacerbate the risk of rupturing blood vessels with increased blood pressure due to centripetal force? Blunt force trauma. You're more likely to pop a water balloon that is already full to its limit. Of course, the bleeding would also be exacerbated by any other traumatic brain injuries or fractures to the skull and face that Baki has sustained thus far, as well as any he might acquire in this particular interaction. And yet, looks like our boy is fine. This is like a fight between Deadpool and Wolverine, both equipped with a recovery factor that outpaces just about any injury that the other might inflict. Apparently, Baki was able to create a little metal toy while being smashed around. The motor control necessary to do something so intricate amidst such chaos. I mean, Baki would need to tense his body to a great degree to brace for each impact against the car, while simultaneously maneuvering his hands gently and precisely. This is positively outlandish. And also, exactly why I love this show.
That's outrageous. Done.
Then he follows up with several powerful blows to Yujiro's face, compromising the structure of the zygomatic, maxilla, and nasal bones with his first blow, and pulverizing the lacrimal and ethmoid and anything left of the nose with his second. The orbital region would also be decimated, and surgery an absolute necessity. Contrary to Baki logic, you cannot concave a face without severely damaging its skeletal structure, as the shape of the bones underlying the skin literally determines the overall shape and contour of the face. The onslaught continues until, well, even in Baki, I guess a surprise kick to the testes is enough to make a man keel over in pain. Due to their essential role in reproduction and overall health, the testicles have many pain receptors that alert us to any danger. Unlike many of our organs, they pretty much live outside the body, protected only by a relatively thin layer of tissue, the scrotum. Unfortunately, this precarious placement is necessary since it allows them to be kept at a slightly lower temperature than the core body temperature for optimal sperm production. As you really begin to understand anatomy, you'll see trade-offs like this all the time. Baki then capitalizes on the stunned Yujiro, who is obviously ecstatic that he will be joining his son at the local hospital for corrective surgery to the bones of his face. Doctors fixing facial fractures typically make small incisions inside the mouth or along natural creases in the face, avoiding the need to peel back the skin. These incisions provide access to the fractured bones, allowing for repair using plates, screws, or wires, while minimizing visible scarring and maintaining the natural appearance of the face. It looks like Yujiro will be joining his son in the emergency department for a laparotomy, which is a surgical procedure that involves making a large incision in the abdominal wall to access and examine the abdominal organs for the purpose of injury diagnosis, organ repair, and the treatment of infection or injury. Now that the Hanmas are fighting at full power, it is crystal clear that their bodies are literally stronger than industrial building materials. Concrete, metal, and, well, you name it, whatever. We all know it's possible to strengthen the body to an incredible degree, bone and muscular strength alike. There are, however, mechanical limits on how much strain each type of tissue can take, as well as how much muscle and bone density one might gain through adaptive training, before the actual systems they support start to fail. To put it simply, if we were as durable as rebar reinforced concrete, we would also be immobile and unalive like rebar reinforced concrete. Remember what I said about trade-offs? And yet, there goes Yujiro punching the concrete to stop his momentum again.
人ならぬ領域の戦い神々しいまでの超人技
As the narrator mentions, this is a battle beyond human scale. These are two primal forces going toe-to-toe in a battle that bends, no, completely ignores the rules of anatomy.
恋人も気づき始めていた
As an orthopedic surgeon, my specialty is the body.
I am a surgeon!
But as these two carry on, I become more and more inclined to psychoanalyze them. Just look at those smiles.
終わりが近い
And even philosophize. What happens when an unstoppable force meets an immovable object? And then suddenly,
親子喧嘩は
a heartwarming father-son moment. Until Yujiro rings Baki's bell to start the proverbial final round with a double ear slap. A technique that, if executed effectively, will sharply increase the air pressure inside the ear canal and cause the eardrums to explode, and the opponent to collapse, disoriented and unable to continue fighting. Really, the eardrum or tympanic membrane is only made of a thin layer of connective tissue covered by a mucous membrane, and it's approximately 0.1 millimeters or 0.004 inches thick. I guess even Baki's eardrums are made of steel. At the risk of sounding like a broken record, facial bones are not made of rubber. Then we have the requisite flurry of punches as per every anime final fight sequence. Yujiro fights Baki's ghost before they share a bowl of imagined soup that apparently everyone in the crowd can see. And Baki wins because he makes Yujiro stand in the kitchen, but Yujiro wins because Baki says so. And everyone cheers because
地上最強の親子喧嘩ここに終了
family. What in the world did we just watch? Be sure to check out my online gym, Human 2.0 Fitness, right here on YouTube for free, where we help you move better and prevent injury. If you liked the video, be sure to give it a thumbs up and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.